everyone, welcome to Digital Health News CXO podcast. Today we have with us Mr. Neeraj Lal, Regional Director at Medicover Hospital. And today we are going to talk about one very important topic that is concerning all the hospitals today in India. Whenever we think about a hospital, we think about large amount of patient files, papers being floated from one department to another department, and an exchange that is based mainly on paper. The information flows on paper. But today, most of the hospitals are turning paper light or maybe trying to go paperless. But paperless is not just a buzzword, it's also a cornerstone, a foundation for a larger digital transformation. And at Medicover Hospital here in Navi Mumbai and across Medicover Hospital branches, this is happening real time, and that is what we are going to discuss today with Mr. Lal. Thank you so much, sir, for joining us here today on Digital Health News.
Thank you very much. Thank you.
So before we begin talking about the paperless hospitals and the systems, and I've seen firsthand, you have shown me how you are controlling it right from the back end, and it's very exciting to talk about. I would just like to touch upon your journey in healthcare, maybe across the year, which are the hospitals that you have been part of in the leadership department.
I did my master's in hospital administration from Mumbai only. I'm a graduate from Tata Institute of Social Sciences in the year 1999 to 2001. I worked in various hospitals, including Apollo Hospitals, Rainbow Children Hospital in Bangalore, Shelby Hospital in Ahmedabad. For quite some time, I'm working in Medicover Hospital as Regional Director for Maharashtra and Karnataka region. So we have 6 hospitals and we are available in 4 states, Andhra Pradesh, Telangana, Maharashtra, Karnataka. So these are the 4 states with managed hospitals with 6,000 plus bed.
And across the decades of your journey into healthcare, I'm sure you have seen this industry evolve, as I said, from paper-based to maybe in a paper light or a paperless situation. Could you tell us about that? What was the evolution like?
So if you see earlier hospitals, if you see there is a place in the medical superintendent office in any typical civil hospital, government hospital, where a nursing superintendent go in the morning and with the help of a chalk, she used to write the occupancy, the midnight census of the hospital, the various patient admitted in the various ward, what is occupancy in the morning. So that was a trend. And there is a big medical record department where piles of file kept at one place, and it is very, very difficult to find the patient file in case you require. So now there is a digital transformation which is happening in this country. Now most of the private corporate hospital got a HIMS which is available, which is admission, discharge and transfer. But now the real challenge is that still they are maintaining files. So they have inpatient record, they have OPD record, though they are management through HIMS. If you see various hospitals in India for corporate hospital, some are 50% compliance, some are 60% compliance, and some are 70-75%. But I'm happy to share Medicover in India is 100% paperless hospital. If you see our floors where our patients are admitted, there are no patient files. Our staff nurses are having iPads and tablets, and everything is managed through a software which is Tech Pro. So the patient consent, the nurse's note, the consultant note, the discharge summary, anything and everything is available on that record, and we have a full control over system. Parallelly, these all medical records is connected to a super app, which is Medicare app. Say for example, all the business integration, number of patients in the OPD, how many patients is converted into IPD. Say for example, a patient enter into a OPD area. So conventionally, he take an appointment. As per appointment, he go to a specialty consultant. Doctor sees the patient, check the vitals, note the vitals, and start talking about the patient history. By seeing at the patient, he's spending more time in writing the prescription, where he need to go to a different places. He need to go to pharmacy, he need to go to pathology, he need to go to radiology, and sometimes you miss the patient. So what we have done now, our everything is e-prescription based. We generally don't give the manual prescription. So from our hospital, there is no manual prescription from the OPD, and there is no file which is generated in the floor. So appointment has been taken, lead has been generated, and we see how many leads are converted into OPD consultation. From OPD consultation, how many actually OPDs happened, and how many OPD consultation were converted into IPD. So a consultation is done. There is a doctor spend more time with the patient talking to him the history, what is the issues, what are the things which is happening, and it is recorded, and automatically a prescription is generated based on the interaction with the patient. And to this prescription, there is a patient support guides. Whenever the patient comes out of the consultation room, they know where to go for pathology, where to go for pharmacy. There's a pharmacy kiosk which help in dispensing the medicine. He's sitting in the OPD only. Automatically a diagnostics is being done. The fellow botanists know what are the tests need to be done, and a pharmacy bag is given to them based on the prescription which is given. So entire this journey, right from the OPD, from the consultation to the pathology, pharmacy, as well as diagnostic, it is seamless and it is paperless. And by the time he reached home, he got a e-prescription.
That's such a wonderful, mechanism of giving patient an experience that is completely seamless. Because otherwise, when you go to a hospital, and one of the major tasks for patient is to figure out where is a particular department. They are given a file, then they are asked to go to maybe a pathology, then the pathology might ask to go to a pharmacy. So this entire experience becomes a tedious point for patients. How has this seamless experience that you have managed at Medicover helped the patients that are coming to Medicover?
Actually, now patient is controlling. Patient know everything which is happening on him. So you generally what happen, including the discharge summary we are sending. So it is very difficult, to keep the discharge summary with you all the time. So if it is available on your mail, if it is available on the e-platform, and there is a Medicover app also where each and everything is there, and you can refer back. Yes. So if you come back 1 month back, so what is your vitals, what is your blood investigation, and each and everything. Parallelly, the super app also help us to track businesses also. Right. Say for example, I can see, what is how many patients seen in the OPD, how many has been advised for the admission, and what is the conversion rate. Okay. Like I used to approve the purchase requisition, the purchase order while I'm in a meeting. I can see when the indent was raised, whether it is as per budget or not, whether it has been approved by the center head or a unit head or a business head, and whether the indent has been seen by 3 people, it has been approved, and then finally comes to you. Automatically purchase order, QR based purchase order is generated, and this QR based purchase order goes to the vendor. Absolutely. So you can control that. You also control, how many OPD slots are available for the doctors. Wow. Can we push more patient in that slot? So this particular doctor got 20 slots for the day. Yes. So if there are more patient, how can we accommodate there? Number 2. Number 3, all our records, right? X-ray, CT scan is available on PACS, which is Picture, Archival and Communication System. So there no need for the hard copies of X-rays. You must have seen this X-rays and sonography while you keep in the back seat of the car, gradually it fade down in the sunlight. Yes. So everything is available on PACS. So a doctor log on to her computer and see what is X-ray speaks about, what CT scan speaks about. So patient also got a control of his entire healthcare journey, and doctor also know. So no need to recall by referring to a record. Say for example, in one of my previous hospital where Honorable Governor visited the hospital, so he was coming with a medical officer with 2-3 jute bags. In that jute bag, you have pathology report, radiology reports and everything. It is very, very difficult for a doctor also to refer. Right. So I think India is in the dramatic stage from a paperless to a digital transformation. And as soon as we reach there, I think we can able to give a good journey to the patient, which is full control of the patient and full control of the hospital.
And to be very honest, it's fantastic to see leadership talk about digital transformation. But for a successful digital transformation, there has to be adoption and well-made adoption among the people who are using it, maybe clinicians or maybe the administrators who are actually using this technology. So when you actually decided to go from maybe paper-based to paperless, how was the journey like, and how was the change management process? How was the response from your staff, your clinicians, doctors specifically?
Change is not very encouraging in starting, but what happened, you have to put the foot down. I think if we give them good support at every level, like removing the patient file from the indoor records is very tough challenge, and doctors are used to write prescription in the OPD. I have seen some of the hospital uses carbonated sheet. So one sheet they write and second sheet they occupy to refer. and there are certain people who are working on those carbonated sheet to track pathology. So it is so manual. And so we have created champion in various departments. There is a journey transformation from manual based to a digital base, right? So like we started this journey in November 24. Every month we have seen the compliance. Where we have reached, so doctors were a part of that team, our medical administrator was a part of team, and a good IT support has been given to various doctors in the team, because if you don't give that support, then it will fall. And one fine day when we feel okay, we are over 75% compliance, and on particular day we have stopped everything and we have shifted to a paperless hospital. In fact, some of the companies like CGHS, like some of the companies still required hard records, to process hard bill. So there is a process whenever anybody require a bill or a report copy. So there is a special request which we need to give, and then the hard copy is given to that patient, because otherwise his bill is not. So I think the culture shift has to be there. In hospital, we have managed this. But I think other ecosystem which is connected to us, like say for example, most of the TPN insurance companies require e-bills, e-files, or the bills which you give to them. But some of them are still using manual thing. So I think within the hospital, we have changed to a digital transformation. But I think other stakeholder which is connected with us, like some of the vendors, like some of the TPAs, some of our corporate clients, we still manual. So we're in the process of that.
Correct. I would just like to add one question here. Since we talk to a majority of, say, chief information technology officers who are implementing these technologies in hospitals, one of the points that they always mention, which is sort of a hindrance, is convincing the top management about what is the ROI from deploying this technology in the hospital. It is always looked at as a sort of a cost center. But since you have already done a very successful paperless transformation at Medicover, what would you say maybe to your peers in the leadership role in hospitals? Why is this technology important?
See, technology is important for three aspects. There is one, healthcare provider, we as hospital. Second is doctors, right, who is a main pillar into the system. And third, you see the patients. So through this, all three are benefit. Number one, hospital. So we have a full control over business. We can see what is happening in the OPD, what is happening in the IPD. I can control the entire business, like how many patient advise admission, how many happen, and how many waiting. I can also control the business, how many CT scan recommended, suggested, how many being done. I can also see, like you see a staff nurse in any of the hospital, she's working with the tablets or iPad. There is no file. She's not wasting her time in noting the records. It is available as an e-prescription. There is a template is there, specialty wise she's doing. Number one. So hospital has a business control, number one, and patient experience is very good. So our reviews have gone up. Patients are happy about that. Number one. Secondly, doctors, the main pillar in the entire transformation journey from manual to digital. So earlier they were skeptical. The people, I want to write a prescription and everything. But now they can refer the patient record as and when they require. Their records are not available somewhere away from the hospital. They need to access the medical record file. Still some of the hospital, whenever a doctor require a IPD file, so there is a request goes to a medical head. It comes after few days or few hours. Now they can go to the Tech Pro and see the patients which they have seen, number one. Secondly, they are also important while they go on the floors and do the round on the hospital. So everything, everything is available on Tech Pro, because this software we have not purchased from outside. It is developed by in-house Medicover team. Wow. Therefore, so it is made by us. So we have a full control over. Correct. So that is the second part of it. And third, the patient. Why patient is very happy? Because patient know each and everything about the treatment. He's not asking for the report. He's not asking where is my discharge summary, where is my records. Everything is available, and you can track the treatment few months back also. So patient is not dependent upon the records, the manual record part of it. So in this, the three people are satisfied, and we are taking care of the patient experience in that way. So now, once you have a control over the business, I think patient is satisfied. Our clinical outcomes are good. We are more focusing on clinical outcome rather than the business processes, and we are happy. And I think it's a long journey, because I think until unless all the stakeholder, do that, that is because hospital is not working in isolation. So there is insurance companies, as I told, there are certain visiting consultant who is coming from outside, and at the same time some of the corporate we still follow the old mundane processes. They require a file and all, so we need to do that.
Correct, correct. And I think this entire process, as you rightly said, benefits the stakeholders, all of the stakeholders, be it clinician, be it the management, and most importantly, the patients. I mean, the patient today is the one who is also using maybe a food delivery app, somebody who is, soliciting some records digitally. So they have digital experience from different departments or different sectors, maybe from banking, from food delivery. But when it comes to healthcare, sort of that experience goes back, say, a few decades back. So I think bringing them back to, say, this decade and say that, okay, this is a digital process and we have made it completely paperless. You don't have to carry a file, you just have to carry a mobile phone and
Walk
a
in and
mobile
walk
app,
out.
walk in and walk out, a digital front door kind of a situation. That's absolutely fantastic. That also brings us to a question of how this data is being managed, because the entire data is being recorded digitally and kept digitally. So how are you managing data security or data protection in a paperless environment?
So we have a team which is sitting at the corporate office in Hyderabad. We have a cyber security audit. So that is a continuous process which we are doing. Since this app is made by us, it passed through a process, and since this is a parent company, our headquarters is there in Sweden, Stockholm. So we have hospitals in away from India also, which is in Germany, Poland, Romania, and all. So we have a data privacy guidelines which we follow all the time, and there's a team which is working. So we follow these guidelines and we do a regular safety audit for this.
So in this entire digital transformation process, I think one thing becomes very, very important now. That is maintaining a physical touch point with the patient. To have a healthcare excellence, a physical touch point where there is a human touch between, say, clinicians or patient between each other. In an environment where the entire system is digitally connected, how do you ensure that there is a physical touch?
You're very right. Actually, healthcare with human touch, I think, is very, very important. Whatever digitization you do, when if a staff nurse or a doctor come to a room and touch your hand and say how you're feeling, so I think it is a different satisfaction altogether. So to support this question, I'll give you an example. We have started a program known as Voice of Recovery. So every month we call the patient who being operated in our hospital, maybe from cardiology, maybe from oncology, GI surgeries and all. We select any 5-6 patients of these specialties along with the doctor who have been treated them, and we call all the patients who are waiting for the admission. Like as I told you, digital transformation will tell you how many patient plan admission need to be done in this week, depending upon the OPD and their converted to IPD. We call all those people and we ask these patients who have been operated upon to come and share the stories, their journey into the hospital for the last 3 months. So they tell, I'm a patient of cardiology, I came so and so time, so and so doctor came, they did this, I was happy, I got a fear, but when they did the surgery, I'm fine now, I'm healthy now. And the patients, future patient who are waiting for the surgery, they can in open front, they can talk to them, depending upon the fear, depending upon the myths and all. So it is a very good platform where a patient who being operated by Medicover Hospital and the patient who is a prospective patient who has been advised for the admission. Yes. So we got a neighborhood team who work on that. They bring all those patients here and there is a platform. They come here, they talk and they share their happiness and their journey and then they go. So this is a platform, this is a practice which we do, which is connecting with the patient.
Absolutely. It's a fantastic initiative because I believe healthcare is one, I would say, sector where you can do business only with the trust.
Same thing, Aarti. If you want to visit any place or you want to go to a restaurant, generally you go to Google and ask which is the best place. You see the rating. But in healthcare, you generally don't do for your buddies. You don't, you check the Google, which is a good hospital to go, and which is a good hospital and which is a good doctor or hospital which is such. So I think this voice of recovery build confidence, build trust, and from real to real stories. So that will make a difference.
Thank you so much. Now, one last question that I would like to ask you about: what is next for Medicover Hospital? I mean, it has been exciting journey for you as well. You have implemented a paperless system in the hospital. What next? Are you thinking about maybe integrating artificial intelligence into the workforce, or maybe some other technology?
See, I think the next few things which we feel can be done. Number one is now AI based treatment. Say for example, some of the jobs, like say for example, if a radiologist is doing 100 200 x-rays a day, I think that is not the thing which he should be doing or he or she should be doing. So if we integrate the AI radiology, AI in pathology, I think it will make a sense. So the X-ray will pass through a AI process and the report is generated. But there are some X-rays which is red flag, which comes out, which is passed through a radiology, because radiology is also developed. Radiology and pathology is a core of any hospital because they act as a supporting agent for our clinicians. So like if you see, we feel okay, there should be virtual ICUs. Like say for example, in this hospital we got 85 ICU beds, but why manage only 85 beds? You can manage 5,000 ICU beds everywhere. So we want to connect all these to a e-platform, so the doctor sitting, they can view the patient records and suggest to those people what can be done. So number of code blue can be minimized and you can take a call on that. So AI, and like most of the hospitals are doing, it's not a new, but I think when we use the AI into the clinical processes, it will help the doctors as well as the patient to take a call at the right time, and we can save the life of patient well ahead. So machine learning and AI into the clinical processes, like say for example, radiology, pathology and critical care are the few things which we want to do that. So healthcare is moving away from the hospital now. So patients come to the hospitals only for critical care, for surgeries and a daycare procedures. Now, like most of the consultations is happening virtually, health checkup is connected. We have a home healthcare platform where automatically a medicine is dispensed to his home once the stock goes out. Like he is getting discharged, a physiotherapist goes to their places, because every patient requires physiotherapy post surgery. Number one, if the drug is pharmacy and consumable is only for a week, so automatically the hospital knows, so automatically the medicine is refilled. And they require any pathology, a phlebotomist goes to his home and collect the sample. So minimizing the hospital visit aim, and followed by, if you require certain surgery or a critical care, then only you are allowed to come to the hospital. So that is a way forward which we feel which will benefit, and only the patient who actually require a hospital admission, they will come to the hospital and take the treatment.
The modern care model is to move away from disease management center to become a holistic care provider model. And I think Medicover is very well into that journey and doing it so well. It was so great to listen to your insights, how Medicover is actually, implementing these technologies and how it is benefiting from it. And ultimately, it is all being beneficial to the patients. Thank you so much, sir, for this conversation. Have a great time.
Thank you, Aarti.
Thank you.